Hello, my name is Kamal Shah. I'm the co-founder of NephroPlus Dialysis Centers, and I've also been a dialysis patient for the last 26 years. In this module, we are going to talk about setting up of a dialysis center. Most nephrologists have an ambition to be part of a dialysis center or even set up their own dialysis center. Dialysis, as we all know, is a very important part of the nephrology ecosystem. In this module, we will go into a lot of detail about what you all need to know to set up your own dialysis center. First, a little background. All of us realize that the burden of kidney disease in India is rising. There is a huge unserved need that exists for dialysis patients. Statistics show that more than 2 lakh dialysis patients are getting added to the pool of every year. When you look at the number of machines that are needed to serve these dialysis patients, we find that while there are about 40,000 machines currently in India, a large 65,000 number more machines are needed. Dialysis centers, only about half, that is 5,000 roughly, exist compared to the 10,000 that would actually be needed to serve these patients. Even in terms of the healthcare practitioners, we just have about half of what is needed. There is lack of adequate infrastructure from hospital chains and standalone centers as well. Another painful fact that we notice is that more than 90% of the dialysis centers are in tier 1 and tier 2 cities, whereas a large number of patients are currently existing in the tier 3 cities and they need to travel more than 50 kilometers to access the nearest dialysis center. There is also a sore lack of trained dialysis professionals, nephrologists and technicians and nurses. So all this goes to show that there is a large unmet need and India can do with a lot of more dialysis centers, and all of you should definitely aspire to be part of or to set up your own dialysis center. In this module, we'll be covering the following points. First, we look at what infrastructure is needed to set up a dialysis center, either in a hospital or a standalone center, which does not exist within a hospital, but it can be in any other location. What are the manpower requirements as per the regulatory authorities? What are the licenses that are needed before setting up a dialysis center? What processes you need to institute while setting up your center? How would you arrive at the pricing that will be charged to the patients in your center? And how a dialysis center would work in terms of responsibilities when you set up a center within a hospital. So first, coming to the infrastructure. So the dialysis center should definitely be either on the ground floor or on a higher floor, provided there is lift access. I think all of us know that dialysis patients typically find it difficult to climb stairs and so on. So this is important from a point of view of accessibility of the dialysis center to patients. When you're looking at a standalone setup, there should be some nearby hospital, because sometimes there are emergencies that happen from time to time, and if there is an ICU within a hospital close by, then it becomes easier to handle emergencies. The dialysis center should also have the required equipment. Now, what equipment are we talking about? One is, of course, the dialysis machines. These should ideally either be FDA approved or CE approved. Then there has to be an RO treatment, water treatment plant that should produce water as per the AMI standards. Now, AMI is a worldwide standard used, and they have a particular standard for the water that can be used for a dialysis session. So those AMI standards should be followed by the RO water plant that is installed. If reuse is being planned of dialyzers, and in a country like India, reuse makes a lot of sense in many circumstances. So for that, it is ideally, while it can be done manually as well, ideally a reprocessing machine is the best way to do a dialyzer reprocessing cycle. You would also need other medical emergency equipment like a defibrillator, suction apparatus, laryngoscope, etc. It's important to design the layout of the dialysis center so that all the aspects of what is needed in the center are catered for. So just to give some examples of what it needs to include, you would need to have a preparation, a storage, and a work area where you store things, you prepare your Part A, Part B solutions, and so on. You would obviously need to have a place for a water treatment plant. Then, if you're having reprocessing, a small room where that will house the reprocessing machine, storage area for new stock that would come, for reprocessed dialyzers that are marked with the patient's name and ID, and some kind of storage for the patient's belongings. You might also require a consulting room for yourself or a DMO, maybe a small desk for the nurse or the technicians to sit and do some paperwork and so on. Then you would need a waiting area because sometimes when patients come, the previous session is not completed. So you would need to have a waiting area with some seating for patients and patients attenders. These are broad requirements. Of course, it can vary from situation to situation. This is just a sample layout that we at Nephroplus use. So if you look at it, the machines are all along the walls, while this layout indicates only negative machines. But if there is a plan to do dialysis for hepatitis C, B, or HIV positive patients, then you would ideally need to have isolation rooms for these three viruses. And then you have the RO plant that is at the, here if you see at the bottom right. And then the basic bicarb and acid preparation area, storeroom, and you have a electrical room for various things. You have a washroom as well. That is also something that would be needed. This is just a sample indicative layout. Of course, based on the specific space available, the number of machines that you have, and so on, you can always modify this layout to cater to the specific needs. The RO plant is a very, very important aspect of your dialysis center. The water treatment needs to be maintained as per the standards, like I mentioned, the AMI standards. For that to be able to achieve, there are a set of components that you need. Just to go over some of the components, first you have a raw water tank here at the left, and then you have a pump that pumps it to the pre-treatment filters. And here we have shown a sand filter, a carbon filter, and a softener. The soft water after the softener goes to a soft water tank, and then you have a pump that feeds this water through a 5-micron filter right to the actual membrane, the RO module, the reverse osmosis membrane. This is the most important component. And then the treated water goes into this treated water tank, from where you have a booster pump that goes through a UV lamp and an endotoxin or a bacteria filter to the HT machines. Now, one important thing to note is you need to have a loop here. So if you see the green line, there is water that's going to the machines, and then it's coming back to the treated water tank. That way, water will not remain stagnant in the lines. That's a very important thing to remember for prevention of endotoxins to build up into the system. This is again an indicative layout based on the actual parameters of the raw water. These things would need to be modified. Coming to the manpower requirement. Now, the Indian Society of Nephrology and the Pradhan Mantri National Dialysis Program or the National Health Mission guidelines, they have stipulated certain criteria, certain requirements for manpower of a well-staffed dialysis center. First, of course, you need to have a qualified nephrologist. Now, please note that the nephrologist doesn't need to be stationed full-time in the dialysis center, but coverage by a nephrologist is important, where they are overseeing the basic operations of the center. They are in touch with the center on a regular basis, and the technicians or the nurses can call the nephrologist if there is any issue that they need to discuss. Plus, it will be good if the nephrologist can visit the center at least once a week and meet the patients and oversee the whole process and make sure everything is going as per plan. In some areas, if a nephrologist is not there, then the guidelines stipulate that an MD or a DNB in medicine with at least 2 years of training in nephrology could also substitute for a nephrologist in case a nephrologist is not available. Coming to the non-doctor staff, a lead therapist or a dialysis technician with at least 6 years of experience is good for providing the dialysis treatments. Apart from that, the typical ratio that's recommended is for every 3 machines, you have 1 technician or a nurse. Now, there is no specific guideline differentiating between a technician or nurse. Total number of technicians or nurses should be such that this ratio is maintained. Apart from that, of course, you might need some administrative staff, housekeeping to for basic cleaning and so on. And there is a ratio given for housekeeping as well, 1 housekeeping staff per 5 machines. So these are the broad requirements. Again, based on the various characteristics of the center or the location and so on, these things might undergo some changes based on your understanding of the ground realities. There are some licenses that you need to set up a dialysis center. Now, again, here it is different for within hospitals and standalone centers. If you are setting up your center within a hospital, then you need a clinical establishment license or a nursing home license based on the state laws. You also need a Shop and Establishments Act license that is mandatory if you're setting up any entity. And then you would need a trade license. This again varies from state to state. So you would have to check the state in which you're setting up the center for the specifics. If you're setting up a standalone center, naturally the requirements are a little more onerous. So first, of course, the first 3 would still hold, but then you also need an NOC from the fire department, a biomedical waste certificate, an air or a water pollution certificate, and a drug and a pharmacy license, because you would obviously be dealing with some drugs and pharmacy products here, and an MOU with a hospital to handle emergencies, because during dialysis, like I mentioned earlier, there could be some complications. So it will be good to have this kind of an MOU to rush the patient to an ICU for further care. Coming to the processes required for setting up a dialysis center. Now, there are some outcomes, some basic monitoring that need to be done to measure and improve quality. So this is best done in a very systematic and methodical manner, where you can document what all we are planning to do and then make sure that these processes are followed by your staff with you overseeing it. So first of all, on the outcome front, I think you're aware that there are few basic things that are important in a dialysis patient's outcomes. One is anemia, then you have adequacy, nutrition, fluid and blood pressure management, and the water and dialysate quality. So these things should be measured as per protocol from time to time, and quality audits either by you or by somebody who's capable of monitoring these aspects and then making recommendations for improvement from time to time are done. Also, protocols need to be instituted by you and the staff for biomedical waste handling, disposing. You would need to tie up with some biomedical waste provider if you're setting up a standalone center. Mostly when you're setting it up within hospitals, you can tie up with the hospital to make sure that the biomedical waste is collected by them and disposed of as per their regular processes. Apart from that, there are some basic files and case sheets that you would need to maintain. So a patient file, which is some basic information about the patient, like the demographics, the primary diagnosis, what are the primary cause of kidney disease, their vaccination history, like you're aware, hepatitis B vaccine, COVID vaccine, and pneumococcal vaccine, and the flu vaccine. This history should be maintained. Access history, what is the history of the access? Did they start off with the jugular? What date? Did they start off with the femoral? What date? When did they get their AV fistula? Have there been more than one AVF? So that kind of history also is very useful in the basic clinical data. And consent forms. Now, consent forms, while it differs from state to state, ideally at least once a month consent should be taken for dialysis. In many cases, laws require you to take a consent every month. So that consent form needs to be filed in this file as well. Apart from that, for every dialysis session, one case sheet needs to be maintained. Now, this case sheet would have some basic pre and post dialysis parameters like weight, blood pressure, pulse, temperature. Intradialytic parameters during the dialysis session, every half an hour, ideally, blood pressure, the venous pressure, ultrafiltration achieved, and the heparin dose administered thus far. These need to be maintained every half an hour, ideally. Any complications that might have occurred should be noted. Any investigations done either before or after the dialysis session, and any medications like erythropoietin or iron or carnitine or whatever medications have to be administered should also be noted in this case sheet should be signed off either by the doctor or the therapist who's doing the session. These are some basic requirements that should be maintained in the dialysis center. Coming to the pricing mechanism. Now, there could be two things in the pricing, right? One is if your center is going to be empaneled with some kind of a scheme, like a government scheme like Ayushman Bharat, CGHS, or railways, or several states have their own schemes, like the Maharashtra has the MJPJY, Arogya Shri from the Andhra Pradesh and Telangana, and then you have the Ma Yojana of Gujarat. Various such states have such schemes. So it's important for you to find out what pricing these schemes offer. There are several private insurance policies also that cover dialysis. So it's good for you to be aware of what each private insurance company offers. And the third option is where the patients pay out of pocket. So when it comes to, you don't have too much control over the first two, right? Where it's a government sponsored scheme or a private insurance. But for cash sessions, that is sessions where patients pay out of pocket, you will have to decide the pricing. Now, this pricing has to be decided based on variety of factors, like what are the cost of the space, the rent that you're paying for the property, or what you have to pay the hospital for setting up the center there, what is the staff cost, what is the electricity cost. All this you need to keep in mind, and prices vary a lot. The market price, like what are the centers around you charging for a dialysis, and then based on that you would need to decide your price. Now, what we have seen Nephroplus's observations over several years is that it varies a lot, of course, the price per dialysis session from state to state and even within hospitals, that the price for reuse generally varies between 1,500 to 3,000 rupees, whereas a single-use session varies from 1,900 to 4,500 rupees based on the location of the center, whether it's in a tier 1, tier 2, tier 3 city, and so on. When you're setting up a center inside a hospital, there are certain things that the hospital will manage. There are certain things that you will have to manage. So, of course, the hospital partner will manage the space. They give you the space. Now, dialysis machines will be accommodated in that space, but the end-to-end build-out of the dialysis unit would be your responsibility. Water and electricity is usually provided by the hospital because they already have that facility. They just need to give you the points. Nephrologist coverage, of course, if you are there, then you don't need this. But sometimes if you are not going to be present there, then you may choose to tie up with the hospital on this aspect. Many hospitals already have a pharmacy and a lab, so you could utilize their facilities for these two aspects. Like I mentioned, the entire procurement of the dialysis machine, the RO plant, the equipment would be your responsibility. Recruitment of the staff and training them and their salary would be your responsibility. Inventory management, that is, ideally you should tie up with various providers or various suppliers to get whatever stock is needed for you to be able to run the dialysis center. Biomedical waste management, you will either tie up with a third-party vendor, or you can also use the center, the hospital's facilities. The dialysis session data that is there, that ideally you should own that, where you can just print out those case sheets or do it in a digital form. And then promotion of the center would be your responsibility, where you promote the dialysis center among your colleagues or other general practitioners, diabetologists, and so on around that area, or directly to the patients so that they can come to the center for their dialysis treatments. So these are broad aspects that we have talked about in this module about how to set up a dialysis center. Believe me, it's a very fulfilling journey. It's a very fascinating and a very interesting journey. And it's very enriching for you to own a dialysis center, enriching in intellectual ways, because to care for the dialysis patients for long durations of time, they've almost become like your family. And you're providing top-notch dialysis care to patients who really need them and giving them a good quality of life and a long life, productive life at the end of the day. So I wish you all the best. I hope you found this module useful. Thank you.